Okay, we are finishing the last bit of chapter 6. Sorry for the bell ringing, as some of you are just going to lunch now on Friday, is when I'm recording this. So, we're talking about cutaneous glands. We finished with the other accessory structures, the hair and the nails, and we're talking about the glands in the skin. There are three main ones you can see here on the picture: apocrine glands, merocrine glands, and sebaceous glands. The apocrine and the merocrine are two types of sweat glands. So the apocrine, I should say, the merocrine or the eccrine sweat glands are the ones that you are familiar with, right? These are ones that produce the watery perspiration to cool your body. They're especially dense on the palms and soles and forehead of your body. And again, the whole key with this is thermal regulation. They are cooling the body as you perspire. The apocrine sweat glands, these are a little bit different. These are located in the groin and anal region, the axilla, which is the armpit, the beard area, the areola of the breasts. These produce a sweat that is thicker, milkier, has more fatty acids to it. And these respond to stress or sexual stimulation. And we believe that these guys secrete pheromones, which are actually chemicals that you inhale. They're airborne, and they actually influence the behaviors of others. So how do dogs know that another dog is in heat and ready to be, to become pregnant, the female hormone, the female dog? Well, these pheromones give them that. And humans produce these same things. There's this whole fad recently where you go to these parties and you smell people's shirts. Like, you bring these old shirts and you smell them, and maybe you'll be attracted to them. And you're talking about these apocrine sweat glands. These are what are producing this body odor, because everybody has their own specific body odor, different from the perfumes or the deodorant you put on. And those are a result of these apocrine sweat glands. Again, the merocrines are the regular sweat glands. I show you some pictures here as we zoom in on those different types of glands, merocrine and apocrine. And these are all being released in these ducts, these long tubes that go up to the surface of the skin. Sweat itself is mostly water, 99% water. It does have that little acidic pH of 4 to 6, so not super acidic, but more acidic than neutral. And the reason for that is that acid mantle to inhibit bacteria from growing on your body. There are also some solutes in your sweat, the saltiness, if you will, if you've ever sweated a lot and then maybe kissed somebody's forehead who's been sweating a lot. It tastes salty, right? That's that sodium chloride that is there on the surface. You produce a decent amount of sweat each day, about 500 milliliters, just what we call insensible perspiration that just evaporates. If you're actually working and exercising and things, well, you can produce obviously way more sweat than just that 50 milliliters. Oh, sorry, 500 milliliters. The third type of gland is called a sebaceous gland. A sebaceous gland is what's secreting sebum. Sebum is that oily secretion that keeps your hair from becoming dry and brittle. It also keeps your skin smooth and waterproof as well, helps with the keratin there. Your textbook makes this funny thought that these sebaceous glands that secrete oil onto our hair, for us white folk, we pretty consistently are washing our hair, and the shampoo we use gets rid of all of that sebum. Well, we don't want to do that, right? Because then our hair will be all brittle and frizzy and stuff. So what do? We put conditioner on our hair, which is basically sheep sebum. There's other pieces, of course, but you're putting the oils back onto the hair. It's kind of this funny thing. I'm not quite sure why we do that, but that just seems to be the way we do it. Here are some pictures of those sebaceous glands, and to remind you what it looks like on the actual large picture of the skin, that we dealt with earlier. Sorry, I can't find it here quickly. This is what I wanted. Here is that sebaceous gland right secreting that sebum right onto the hair follicle. So as it grows, that oil comes out. You also have your apocrine sweat gland down here coiled up. And then over here we have the merocrine sweat gland. That they're showing you a piece of skin that has both of those. If we move into the last couple of glands, so those were our big ones, the apocrine, the merocrine, the sebaceous, but there's a couple other specialized glands we want to deal with. The first of those is the ceruminous glands. The ceruminous glands are in the ears, and these produce a substance called cerumen, and what that is earwax. Well, why do we need this there? Well, it's protection. It helps kill bacteria and guards the entrance from foreign things coming in. But it also helps keep the eardrum pliable. The eardrum is this thin layer of tissue that has to vibrate as sound waves come into your ear. And so this earwax, this cerumen, helps keep that pliable and movable. It also helps to waterproof the canal. Again, because you're going swimming, you want that water not to stick around in there. You want it to quickly flush back out. The last type of gland we'll talk about, specialized glands here, are the mammary glands. Now, mammary glands do not mean breasts. They are not the same thing. The mammary glands are the actual glands that produce the milk, only during pregnancy and lactation. And these are a type of modified apocrine sweat glands. Wait, you're saying breast milk is actually modified sweat? Yeah, in a way. It's a totally different substance made of different things, but they're the same type of glands that produce them. And of course, these ducts all release through an opening at the nipple that the baby very easily can get and take. For us humans, we only have one set of nipples, but most other mammals actually have multiple of them. Sorry about that, I had to pause for a moment. We were talking about the fact that many mammals have more than one mammary gland, so therefore they have more than one nipple that runs along these what they call mammary ridges or milk lines, but we as humans do not have that. Though there are very few people who do have something called polythelia that do have very small undeveloped second or even third nipples in places. An interesting piece to dive into on Google. Skin disorders is where we're going next. We have two big pieces we're talking about, skin cancer and burns. So let's talk about skin cancer first. Caused mostly by the UV rays of the sun that damages the skin's DNA. What parts of the body are most affected? Well, the parts that are actually in the sun more often, head, neck, hands. Obviously, if you are doing a lot of sunbathing, other places where you have more skin exposed, then sure, you can get skin cancer there as well. Certainly affects more us fair-skinned people and the elderly because their skin is not as resilient. One of the most easily treated cancers, also one of the most common cancers. And you can survive skin cancer usually very well if it's detected early, and treated early. Three types of skin cancer we'll talk about, and they all are named based upon the epidermal cells in which they originate. The first is basal cell carcinoma. Basal cell is the most common of these skin cancers, and it arises from the stratum basale. Boy, I just can't get this done, can I? Hold on. All right, we're back again, sorry. This basal cell carcinoma arises in the stratum basale. So we're talking about the cells at the very bottom of the epidermis, which is again why they call it basal cell, basale, basal cell. See, that's why where they get, again, anatomists are not creative. This kind of cancer seldom metastasizes. Usually it is just in the area where it is this small shiny bump with edges on it. Kind of looks like it has a bit of a scab on this one in the picture here. Usually you slice that thing off and you're good to go. Our second type of cancer is a squamous cell carcinoma. Now, these guys arise from the keratinocytes. I can never say that word. in the stratum spinosum is where these guys go from. They can metastasize. If they do metastasize, they go into the lymph nodes usually, but often you can get rid of it and recover from it if you have surgical removal and they detect it early before it metastasizes. Once it does metastasize, and of course metastasize means to go to a different place from where it originates from, then that can be a lethal something. And the last of our skin cancer pieces is a malignant melanoma. And of course, melanin, melanocytes, melanoma, all the same roots. So this is a skin cancer that arises from the melanocytes. You can tell it because it's dark, right? Remember, melanocytes produce melanin. Melanin is a dark pigment, so therefore a skin cancer, a melanoma, would have this dark lesions like this. If it's caught early, it can be removed and be successful and not have any problems, but this is a highly aggressive form of cancer that does very quickly metastasize, so it can be a very difficult thing for you to recover from. This is not covered in the slideshow, and I wish it was, but there's the ABCD rule for you to recognize cancers. The A stands for asymmetry, so if you cut this thing in half, it's not symmetrical, right? If you look at the B as border irregularity, see how this is all back in, then out, then in, then out, versus this little mole here is just a reasonably round structure. So if the border is not smooth, then that's one way of telling something is a cancer. If the color changes, that's the C of the ABCD. If the color changes, so it was a reasonably light spot and now suddenly it's turned very dark, that would be a problem. Also the diameter. If it starts out this size and then in a month later it looks like this is a problem. So again, that doesn't mean that any mole or any little spot on your body that fits any one of these four categories is cancer. It doesn't mean that. But it means it should be something you should get checked out. And truthfully, all of us should be seeing a dermatologist on a pretty regular basis so that we can have what they call skin checks, where they check to make sure that these places are not cancerous, or at least get an ideal of, okay, here's what your moles look like now. In a year, we look at them again, and we see that, oh yeah, there's a problem here. Let's get rid of this guy. Burns is our last piece of this section. Burns are the leading cause of accidental death. Lots of different ways to get burns, from fires, from chemicals, from acids and bases, from shocks. Why do you usually die from burns? Well, from fluid loss and infection. The actual burn process itself is not necessarily the problem. It's the after effects. And the worst part about burns is the fact that you have to debride them. You have to get rid of this burned dead tissue called the eschar. A very painful, very unfun process. In my PT career, I had a number of burn patients that I worked with when I worked in a couple of hospitals. And it's just not a fun thing at all. It's one of those things that, I've told my family, if I'm ever burned that badly, please just let me go, because I don't want to deal with that nastiness. It's a painful, no fun thing. We'll talk more about it as we go here. We classify our burns based on degree, which is based on the depth of the tissue involved, how deep it goes. So at first degree burns, those involve only the epidermis. You'll notice redness, there'll be some swelling or edema, and those are painful. And that's like a sunburn, like you see right here. Just only burning the epidermis, you get this nice, tasty red skin here. Very painful, usually heals a week or so. No significant scars or problems from that. A second degree burn is also what we call a partial thickness burn. So now we're past just the epidermis and we're down into the dermis in some varying layers. It can be just the very top part, it can be all the way down almost to the subcutaneous. It just depends on the level of the burn. Those are all called second degree burns. So this may appear white or tan or red, blistering. If you get blisters on a sunburn, that means you have actually gotten second-degree burns. These are much more painful. Oh, this is not a fun thing to deal with, these second-degree burns. And those can take a couple of weeks, even to several months to heal. And again, based upon the depth, they may leave some significant scars there. Third-degree burns are the worst. We also call them full-thickness burns. This involves all of the epidermis, all of the dermis, and even sometimes the deeper tissues. You can get burning that's down into the adipose tissue, even down into the muscle or bone below those tissues. Very deep, very painful. Not painful. Why are they not painful? Because you've actually burned off the nerves. Right? You've gotten past all of these things. It's the healing process of these that is extremely painful, because as the skin starts to come back and you have these skin grafts, and oh, it's not a fun thing. Not a fun thing. Burns are not a good thing in my humble opinion. I don't really have, I guess they do have, no, they don't really have any pieces. How do we treat these? What's the main things we're worried about when we're treating burns is fluid replacement, because if you ever had a burn, especially like a sunburn that actually opened with a blister, it weeps. There is this weeping process, this fluid that comes out of the burn. So you have to make sure that the person stays hydrated. And the second piece is now you have an open area where bacteria can get into the skin. So therefore, infection control, preventing yourself from getting an infection is a huge deal. On the last piece, which I don't have a picture of, I wish I did, but on page 197, there is a fantastic picture diagram that shows how the integumentary system interacts with the other systems. In my opinion, this is one of the most important pages on the entire textbook. These pages, each system, as we go through them, will have one of these effects of the blank system on the other organs. And it shows you, here's what they do, here's how these guys interact. And I do want you to be comfortable with this, because the key point here is that as we go through these systems, don't think of the integumentary system as being all by itself. It doesn't only do its thing and doesn't affect the other ones. All of these systems interact together. So I do want you to be comfortable knowing how the integumentary system interacts with all these other systems. This is a very easy multiple choice question on a test, or even a short answer piece of describe how the endocrine system interacts with the integumentary system. Or how does the respiratory system interact with the integumentary system? Hopefully that makes sense for you. If you have questions, please don't hesitate to contact me. I'll try and actually take a picture of this, because I don't have it on the computer. I'll take a picture of this and post it up so you know exactly what I'm talking about. But that is something that's on your study guide and will be something you will see on the test. Of course, if you have questions, you may email me, you may text me. 410-977-6086 is my text number. Smoke signal I probably won't get because I'll be in Michigan, but please feel free to contact me if there's any questions you have.